Hello, I'm Beverly Kirk, Director of the CSIS Ideas Lab, here with Dorothy Shea. She is the Director for Assistance in Asia and the Near East in the State Department's Refugee Bureau, and we're talking about the targeted attacks against medical professionals in Syria during the conflict, and thank you for being here.
Thank you for having me.
What is the U.S. government's reaction to the attacks on Syrian medical personnel and facilities?
Hospitals, clinics, doctors, and medical staff are being deliberately targeted in Syria. 52 have been documented as killed, and we believe the number is probably much higher. A number have been wounded. Close to 600 may be imprisoned. Other medical care providers fleeing for their lives have fled the country. More than half of the public hospitals have been damaged. It's a crisis situation. The United States strongly condemns deliberate attacks against healthcare providers, healthcare facilities. We've got to do something to protect these humanitarian providers of service. They provide their services on an indiscriminate basis to civilians, and they should not be targeted.
What kind of humanitarian support is the government providing to the victims in this conflict?
Against the backdrop of these kinds of indiscriminate attacks that we were discussing, the life-saving work of humanitarian organizations goes on, and the people who carry out this work are really heroes, and I'm proud that the United States government is supporting them. In fact, the United States is the largest contributor to the UN and other appeals to support the humanitarian response, both inside Syria and in neighboring countries. To date, we've provided almost $510 million. Just this week, Secretary of State John Kerry announced the latest tranche of $100 million. And with this money, we provide funding to humanitarian partners who make available to civilians basic services, whether it be food and water, shelter, healthcare, very importantly. And that's whether they're inside Syria. Many are displaced multiple times, or of the 1.5 million almost now who have fled to neighboring countries. It's very important that those neighboring countries who are hosting these civilians know that they're not alone in responding to the crisis. So we're making our support very tangible, both to the governments and to the host communities who have opened up their homes and their facilities to those fleeing the violence.
Dorothy Shea, thank you so much.
Thank you.